Hi everyone, welcome to Values. So with that New York Times article that came out and kind of just like put a fire of skepticism under Humacyte, we've got none other than Rishi Kundi, who came onto Reddit to answer some questions around that. So I thought that was really cool. This is someone who's actually used the product and who has a lot of knowledge in terms of trauma. So he's come out, and this is one person that would be in the best situation to kind of, in a sense, defend Humacytes Symvess product. As it says here, it's never occurred to me to search up my own name on Reddit. Anyway, here we are, happy to answer reasonable questions anyone has. For transparency's sake, I am not and have never been paid or otherwise compensated by Humacyte. I own a token less than 10,000 amount of common stock that I purchased myself last year. So this guy, in a sense, he's used the product and he kind of has a lot of kind of confidence of how good the product is. He even purchased some shares, but as he says, he's no way compensated by Humacyte. So everything he says is his words, and he's putting his own reputation on the line by doing this. I'll post a Reddit thread link in the comment in the description, so you can definitely click on it and then have a read of this. There's so many questions, so many comments, that if I went through this would be a very long video. So I've just kind of like took 5 or so relevant kind of questions, and then we'll just kind of go through that. But definitely, you can definitely just read through it yourself, unless you like me reading it or some commentary. So I'll read the questions and then also his response. So, hi Dr. Kundi, obviously Humacyte is under quite a bit of fire. That's not unexpected, as they're introducing a new product to the field of medicine that hasn't changed much. You stated in this thread that the rupture rate does not worry you, as it is consistent or less than other treatment options in vascular trauma. Does Symvess provide any competitive advantage to legacy options, non-vein, that would warrant physician adoption? Thank you for your time. So in the New York Times article, there was mentioned that apparently they have Symvess can have a rupture rate of up to 10%. And this is what Rishi Kundi's kind of response was. Bear in mind that I am going to say, what I'm going to say is entirely my experience and nothing more. When my patients with Symvess have ultrasound or CT imaging 3 or 4 months after their repair, neither the radiologist nor I can see that there is any graft there. The idea is that the person's cells grow into the scaffolding of the graft and make it their own, which doesn't happen with any other conduit. I haven't seen the histology on this. I am not privy to any of Humacyte's research or imaging data. That isn't a matter of public record. But in my patients, it's as if they've never had surgery at all. And as for the competitive advantage, I had put Symvess in a young man who was septic, who had blown out not 1 but 2 other grafts, who had literally pus on in his leg. He's my success story of 2024. So yeah, like in his mind, in terms of rupture, like his experiences, firstly, when it's put under imaging scan, like it just all seals up, so that you basically couldn't tell that surgery had happened. There is another comment later on where he says ruptures are pretty normal in a sense, like failure can be quite high in other products as well. So the mention of rupture, it doesn't sound great, obviously, but it is just one of those common statistics that does happen in surgery, in terms of trauma anyway. So here we go. Purely selfish theoretical question, but straight up, if you're in charge of making a decision as to whether or not to buy Symvess for your hospital, would you do it? If not, what is holding you back? I will say this This is one strange week. After everything with this company, I was not expecting to have an AMA with a surgeon. Thank you for your time. Absolutely, I would. I understand that the cost is high, but consider the aggregate cost savings of not having to take a patient back for a revision bypass, of not having to put them in ICU for a week, of not having to keep them in-house on antibiotics. Every day in the ICU costs between $4,000 and $11,000. How I don't have to do the calculation. They're published about it. So there you go. So like in terms of other products, like you have all these other considerations with Symvess. It reduces the time they're in hospital, which is costs. Everything is costs at the end of the day. And his first-hand experience is it saves costs. So in a sense, it would be in their minds that this product is worth buying. Okay, so should retail investors be worried about the 9% graft failure and rupture rate? If no, are there ways to or plans to address it? So this does go back to the first question as well, with the rupture rate. I think that is generally the main concern, because that New York Times article did make a lot of make it out as quite a big concern. Of course, rupture rates, aren't ideal and are a concern. So in terms of Rishi Kundi's reply, in vascular trauma cases which have a notably higher rates of contamination than elective or even emergent vascular surgery cases, there is a 10 to 20% anatomic disruption or failure rate regardless of conduit use. So as I said previously, regardless of what they use, there is going to be a failure rate. That's within that kind of margin. If you want to know how often it occurs, consider that I explained a prosthetic graft yesterday for rupture, and on Friday I took out a bovine cellular allograft that had both failed and ruptured. I don't think that Humacyte is perfect by any means, but I am not at all concerned about the rupture rate. It's a problem of the disease, not the graft. Like that just, in a sense, I think that kind of eases the worry, because like obviously when common people like us who aren't surgeons read such a rate and hear the word rupture, failure, it kind of sounds scary and problematic, but with this guy, like, he's seen it and he does not think it's a problem. I'm curious about the general chatter surrounding Symvess. What are you hearing from your colleagues in the field? Is the buzz positive, or are there concerns or areas that need more explanation before wider adoption? That's what's weird about the Times story and a general apprehension from the lay world. When I said that this is going to change vascular surgery, it's not my opinion, it's the opinion of every surgeon with whom I've talked. For the last 5 years, every conference I've attended has had at least one talk that ends of the slide with a heading like "Solutions on the Horizon" and shows a picture of Symvess. The drop-off in desirability from an analogous vein to prosthetic is massive, and the prospect of something that is better than plastic and will potentially have long-term qualities of vein is extremely exciting. I am not paid by Humacyte and never have been in cash or options or anything. I do not have a token amount of common stock I brought myself last year. I do have a token amount of common stock I brought myself last year. My advocacy is entirely based on my hope to see this widely available. So that even this guy finds that kind of the New York Times story, in a sense, quite weird. Obviously it given the timing, particularly with with the kind of capital raising, it's quite weird. And as you know, mentioned as well, because like the FDA guy that retired, that's come out in this in the New York Times article, he's a consultant, so you know, obviously he can be paid to have an opinion, but whether that opinion is good or not, you know, that can be to certain parties' benefit, because at the end of the day, this guy's come out, you know, he's gone from the public kind of area of the FDA, and then he's gone into consulting, which is private, and he can be paid who knows how much to say on what his experiences are. And potentially, you know, you have these companies that want to short the stock, and they grab his opinion, and what do you know? So hence why there's a lot of things that are up for manipulation at the end of the day. But obviously we interpret all these things how, you know, in a different way. So I might see it as generally quite a hit piece. Rishi Kundi kind of finds the story kind of weird. This FDA guy retired from the FDA, and he becomes a consultant who can be paid privately for an obscured opinion in some sense. Obviously he is using facts, but you know, it might be just put in a way that you know, has a terrible effect on the share price. Alright, so this will be the last question, but definitely there is so much more. Okay, Dr. Kundi, thank you for your willingness to dive in with this ramble. You don't have to dig too deep to see that it can get pretty salty around here. There's a lot of questions surrounding this being a game changer and comparing it to the current standard of care. To that end, changing the game certainly appears to be a challenge in many respects in any number of different fields. So in this instance, however, based on your experience with the product, what are your thoughts on the changing the standard of care? Clearly new and amazing gets pulse racing, but in light of the studies you have shared with us, coupled with your own experience, do you think Humacyte is on the cusp of something that will change Z's standard of care? And if so, would you be willing to conjure on what time frame might be for such a shift? If so, I think it will change. So Rishi Kundi says, I think it will change the game more in trauma than in elective pruritive arterial disease, at least at first. I can't comment on how it will change dialysis access, because the economics of that subspecialty are really complex. If Humacyte will result in an AV graft that stays in patient and usable for years, it's going to supplement prosthetic, which has a 50% failure rate at 1 year. So that just that's got a lot of information itself. So like the fact that a prosthetic graft has a 50% failure within in 1 year, yeah, that doesn't sound great either. So you can look at a stat of like Symvess and go, oh, it has a 10% up to a 10% rate it could rupture, but you look at prosthetic and you go, oh, 50% failure rate. You know, these are just in a sense they're gruesome statistics, but they're in some sense common statistics with medical. What I worry about is that if Symvess is everything that Humacyte hopes it is, surgeons will stop trying to harvest vein at all, which is extremely tedious work. Already there are distributable vascular surgeons who use EPTFE, which stands for synthetic, without even looking for a vein, because it halves the operative time. If you can give them a solution that is better than plastic, they'll use it, even if it costs multiple fold more. So yeah, like that is also a statement that is actually quite beneficial to Humacyte, because it means even if over time, if Symvess is actually that good, surgeons are actually going to be lazy and they're just going to skip searching for a vein. So even though some of the stats goes, hey, in quite a like half the cases, patients have appropriate veins that can be used, and there's enough time to harvest the vein. But because there are some surgeons that are lazier, they can just say, oh, actually, there's actually not that much time. Let's just get the surgery done. It's just going to cost a little bit more because you were using Symvess over your own vein, but it's going to lower the risk because we don't have to spend another hour looking for another vein. So in a sense, like, while we've got stats that go, oh, that vein will be, it's more, at least half the time it's usable, but you have to also consider, hey, that surgeon may just want to save time and get this operation over with, and he can just do it straight out of a Symvess package. So in a sense, while we estimated the sales based on the rate where Symvess would be required, which the company estimated around half, that could actually be much higher because of what the statement says here, where some surgeons just think it's just quicker and easier, and they just they don't want to spend that time and that tedious work trying to harvest that vein. So there's a lot of good snippets by Rishi Kundi in this, and definitely it makes you feel a lot better, especially after that New York Times article. And he's definitely someone that can come out and kind of defend Humacyte. There is another comment somewhere that he says he's seen about 10 patients who have used this product, and he works with a lot of colleagues that also work with this product, and he's never seen any problems. So but obviously that's his experience, and that's why you have trials that expands a lot of patients, because everyone's experience can be different. And obviously some of the statistics do prove that there is some problems. It's not perfect, and at the end of the day, no product is perfect, but if you're able to have a higher benefit and lower the risk compared to other things, then obviously it's better. Especially say like amputation rate. Humacyte lowers it, what was it, like less than 10%, whereas this, the usual case is like 20 up to 20, close to 25%, I think. So it's definitely much more beneficial. And if you gave a patient a choice, it's like, would you rather use this and lower your amputation rate, or would you rather use this and lower the costs? If you were to choose, what would you choose, right? Most people want to keep their limbs, and they'll probably choose the rate where it has a lower rate. So that's where Symvess starts to win. So when it comes to this, you have to consider that, hey, surgeons make a decision, patients also make a decision, and even if they go, oh, we can use your vein, they may not, because it may be like too tedious, too time consuming, adds a bit more risk than they're comfortable with. So there's all sorts, but definitely from this, you can kind of just feel a lot more at ease that Symvess is a good product, especially based on like Dr. Rishi Kundi's kind of views and also his colleagues. So everyone can say whatever they want, but these are actually surgeons who have used the product, and that's quite a different story. Alright, well, thanks for sticking with the video. I know my reading's probably not as kind of smooth and great, but so hence why I posted a link. You can just read it yourself if you don't like the narrative, the way I kind of narrate. But I've done my best. I thought this was definitely quite interesting, especially Rishi Kundi coming on Reddit to just kind of give everyone a really good response for all the questions they had. Well, okay, thank you for watching, and until next time, good luck in investing, everyone.